My name is Richard, and I'm here to talk about PPEs. Those are personal protection equipment. In hospital settings, they're typically gowns, gloves, masks that you may need to protect yourself and your patient from possible contamination. There are standard precautions, and essentially is to protect you and your patients from direct or indirect contact uh, with potential pathogens and cut down on hospital-acquired infections. There are three um, transmission-based precautions, and each precaution does have their own specific set of equipment that may be necessary. There is contact precautions, and in that case, gloves and gowns are necessary. For uh, droplet precautions, simple surgical masks, as well as gloves and gowns, and perhaps shoe covers would be something to consider. Um, for airborne precautions, the requirements is basically everything: gloves, gowns, shoe covers, hair covers, eye protection, as well as N95 masks. So before entering your patient's room, you would review their chart, seeing what kind of precautions that might be necessary. You would gather your equipment as needed. Before donning your equipment, you would uh, do the proper hand washing technique, 15 to 20 seconds with soap and water or with a hand sanitizer. Once you do that, you can go ahead and, in terms of the sequence, you would start with your shoe cover, uh, hair cover, eye protection, and then your mask. And we'll be using the N95 mask here. That's the chin, you pull it over, and you would adjust the straps as needed. Adjust it with the bridge of your nose right here. Following that, you can then place your gown on. There are strings right here at your waist, and you would simply loop it around your waist and tighten. And then on the neck, let me adjust my strap a little bit. And then on the neck, there is another set of strings, which you would then do a loop. Once you have those on, you would then put on your gloves. Do be sure to put the cuff of your gloves over your sleeve to reduce the amount of skin that might be exposed to floating pathogens. And hands up, just enter the room. After you finish your procedure, you would remove your equipment the same sequence: shoe cover, hair cover, eye protection, and the mask. Pull away, then out. And all your equipment needs to go into the proper receptacle, biohazard receptacle. In a normal situation, the gowns would simply be ripped off, but in this case, we do want to reuse this one. Just cross your arms and pull forward, and you would roll your gown away from yourself. And dispose of it like so. Remove your gloves, just basically pinch, and then go underneath, careful not to contaminate yourself. dispose of that. You would step outside. Again, do a proper hand washing, 15 seconds with appropriate soap or hand sanitizer. And that's basically it. Thank you for listening.